Okay, we're going to start with anxiety disorders. These are psychological disorders characterized by persistent anxiety or maladaptive behaviors that reduce anxiety. These include generalized anxiety disorder, panic disorder, phobias, obsessive-compulsive disorder, post-traumatic stress disorder. Generalized anxiety disorder is a disorder in which a person is continually tense, fearful, and in a state of autonomic nervous system arousal. This includes free-floating anxiety, where a person cannot identify the cause of their tension. This is also often coupled with depression, physical problems such as high blood pressure. There's a gender bias. 2/3 of those with generalized anxiety disorder happen to be women. Panic disorder is an anxiety disorder marked by unpredictable, minutes-long episodes of intense dread in which a person experiences terror, chest pain, choking, or other frightening sensations. These can be so severe that they're misread as heart attacks or similar. Smokers have at least a doubled risk of panic attack because smoking actually includes nicotine, of course, which is a stimulant. So part of anxiety includes this overstimulation of the neural system. So when you are already prone to this kind of behavior, it makes sense that a stimulant would make it worse. A phobia is an anxiety disorder marked by persistent, irrational fear or avoidance of a specific object or situation. This can actually trigger a panic attack. Social phobias include being judged by others, a fear of being judged by others. Agoraphobia, a lot of people think that that's a fear of crowds, but it's not. It's actually a avoidance of situations in which panic may strike, escape may be difficult, and help unavailable. Phobias seem like they wouldn't be a big deal. We have a lot of common phobias, so why would it matter if you're afraid of snakes or spiders? But what if you're afraid of closed spaces? To the point that you can't ride an elevator. You might be able to be just fine out here, but if you lived in a big city, that would be particularly crippling. So you want to make sure that you take phobias seriously, because while it might not be a big deal for you, phobias can be very, very crippling to people in certain situations and with a certain phobia. Obsessive-compulsive disorder, this is characterized by unwanted repetitive thoughts, the obsessions, and or actions, which are the compulsions. These can be to the point that effective functioning becomes impossible. People with OCD may have it to the severity where they have a certain routine that they have to do in the mornings to get ready, and if any part of that routine gets off, then they have to redo the entire routine, which would make doing something like holding on a job pretty impossible because you would always be late. And so we like to make fun of this or treat this disorder lightly, but it's actually quite serious in its more severe forms. Post-traumatic stress disorder is an anxiety disorder characterized by haunting memories, nightmares, social withdrawal, jumpy anxiety, and or insomnia that lingers for 4 weeks or more after a traumatic experience. Immediately after a traumatic experience, some level of those kind of symptoms is normal. You just had something traumatic happen. So it has to continue happening more than 4 weeks after for it to be considered actually PTSD. The odds of getting PTSD after a trauma are higher for women than for men. However, currently there are more male patients due to, the war and the fact that these people are being exposed to combat and situations that people would normally be put in. Most people display survivor resilience, which is the ability to recover after severe stress. Some people may have more sensitive emotion processing limbic systems than others, which leads them to be more likely to develop PTSD versus other people. Understanding anxiety disorders, how do anxious thoughts and feelings arise? We have the learning perspective, which includes fear conditioning and observational learning, and then the biological perspective, which includes genes, the brain, and natural selection. The learning perspective, we have fear conditioning, which is classical conditioning, can produce fear and anxiety. Stimulus generalization, a person experiences fearful events and later fears similar events. We went through this with little Albert. He was afraid of the white rat, and he later generalized that to be afraid of all white furry objects, so a white bunny, a white kitty, even Santa Claus. Feeling relief by escaping a feared situation can reinforce that phobic behavior. We also have observational learning. We may learn to fear by observing others' fears, so parents can transmit their fears to children. If your parents are afraid of dogs, you're likely to never be exposed to dogs, and then they're also telling you you should be afraid of them by pulling you away in the way that they act around dogs. So you may be afraid of dogs despite never having an experience with a dog. The biological perspective, our genes, fearfulness seems to run in families. And then also our brain. Fear learning experiences cause new brain pathways, which can make easy inroads for more fearful experiences later on. When we look at the brain scans of OCD patients, these reveal higher than normal activity in regions involved in impulse control and habitual behaviors, so they may be more prone to developing this kind of fear stuff because of that. Also, natural selections. We evolved to fear snakes, confinement, toxins, and heights. Our phobias focus on dangers our ancestors faced. Compulsive acts typically exaggerate behaviors that help them to survive, like grooming and cleaning, so the people that compulsively wash their hands. Right, dissociative disorders. This involves a separation of conscious awareness from previous memories, thoughts, and feelings. This is implying this patients have dissociative identity disorder, and the therapist is asking, would it be possible to speak with the personality that pays the bills? Dissociative identity disorder used to be called multiple personalities. That is not the correct term, however. It's extremely rare in which a person exhibits two or more alternating personalities. Between 1930 and 1960, there was approximately 2 cases per year. However, by the 1980s, after they made movies like this Three Faces of Eve, there were 20,000 cases. It is much less common outside North America. It may be a cultural phenomenon. It also may be an extension of the way that we vary the selves that we present, because part of what we do is we might present one self to our grandmother, and we're completely different around our friends. Well, if you experience severe trauma in early childhood, well, that can have an effect of making your personality, instead of being just a piece of it that you present to other people, it becomes an entirely different personality. But what we currently believe, and diagnosis has dropped off very sharply for this disorder, what we currently believe is this only occurs with severe trauma in early childhood, before personality has fully coalesced, or that means come together. Personality disorders, these are characterized by inflexible and enduring behavior patterns that impair social functioning. Antisocial personality disorder is a disorder in which the person exhibits a lack of conscience for wrongdoing, even towards friends and family. It is more common in men, and they may be aggressive and ruthless, or a clever con artist. One example is the BTK killer. He was fully functional, had a family, went to church, worked in the church. However, he also was a serial killer and killed people in very violent ways. They have a lack of conscience that manifests before age 15. Most criminals do not have this disorder, and there is a genetic component. It appears as low arousal. They have lower stress hormones than average children, and they are slower to develop these conditioned fears. Combined with childhood abuse, these can wire the brain for antisocial behavior. Antisocial personality disorder, we took some brain scans. The frontal lobe normally, of course, helps control that impulsive and aggressive behavior, and these are very much less active in this disorder. You can see it's lit up in a normal person. However, in somebody with this disorder, you have some yellow activity where it was red and orange in a regular person, and mostly green though. So much less inactive. Much less active. Much more inactive. Alright, substance-related disorders. These are maladaptive patterns of substance use that can lead to significant impairment or distress. Substances are often psychoactive drugs, which are chemical substances that alter perceptions or moods. A drug's effect depends on the biological effects and the user's psychological expectations, which of course vary with culture. The DSM guidelines, remember that's the Diagnostic and Statistical Manual that we use to diagnose people. These include failure to meet obligations, repeated use in situations where it's physically dangerous, continued use despite problems caused by the substance, and repeated substance-related legal problems. Tolerance, addiction, and dependence. Tolerance is a diminishing effects with regular use, so you require larger doses to experience the same effect. Addiction is a compulsive drug craving and use, and then withdrawal is discomfort or distress following discontinuing drug use. So this would be like if you stop drinking caffeine and you get a caffeine headache. That's actually a withdrawal symptom from caffeine addiction, which is a physical dependence, a physiological need. So your body actually needs the drug, or it has these withdrawal symptoms. You can also have psychological dependencies where it's that your drug is used to relieve negative emotions. So you're using it as an unhealthy coping mechanism instead of it being an actual, your body needs it. So here is a list of what the DSM says substance dependence is. You need 3 or more of the following: tolerance, withdrawal, taking it longer or in greater amounts than intended, little desire or effort to regulate your use, much time is devoted to obtaining the substance, you abandon or reduce your normal activities, and you continue to use despite knowledge that the substance worsens problems. There are different types of psychoactive drugs: depressants, stimulants, and hallucinogens. These all work at the brain synapses. They stimulate, inhibit, or mimic the activity of neurotransmitters. Depressants calm neural activity and slow body functions. These include alcohol, barbiturates, and opiates. Alcohol slows neural processes. These slow the sympathetic nervous system activity. It disrupts memory formation by suppressing REM sleep, which helps to consolidate memories. Our expectations do affect our behavior, and as far as alcohol use goes, we actually have given people what they thought was alcohol but was not. And people who thought that they had been drinking alcohol were more likely to feel uninhibited and sexually interested, even when they were not actually drunk. So even just thinking you're drinking causes this effect. Chronic alcohol abuse shrinks the brain. You can see here the brain scan of a woman with alcohol dependence versus a scan of a woman without alcohol dependence, and how the open places in her brain are much larger and filled with fluid versus the person with a healthy brain. Warning signs of alcohol dependence: if you binge drink, if you regret what you say or do when you drink, when you feel guilty because you've been drinking, if you are drinking to cope with depression or anxiety, or avoiding friends or family when drinking. Barbiturates are tranquilizers that depress the activity of the central nervous system, which reduces anxiety but impairs memory and judgment. These are sometimes prescribed to induce sleep or reduce anxiety. Opiates also are a painkiller. These come from the opium plant and its derivatives, morphine, heroin, and then some lighter derivatives such as codeine. These depress neural activity, lessening pain and anxiety. They mimic the effects of our endorphins, which we've talked about before, which are the body's natural painkillers, and therefore are highly addictive.